Good afternoon, everyone. Thank you so much for taking the time out of your schedule to log on to the Beneficiary educational session. Our session this afternoon is brought to you by the National Health Insurance Authority. And just want to go over a few of our housekeeping rules for this afternoon's agenda. Throughout the presentation, you'll be given the opportunity to ask questions to our presenter this afternoon in the person of Dr. Keith Rivers. And we're asking that you place your questions in the chat, and the questions will be read to Dr. Rivers during the question and answer period. We are also recording the session this afternoon. And so the session will be placed on our social media channels, particularly Facebook and YouTube. And so feel free to like our channels, like our pages, and share the video once posted. All right, good afternoon again, everyone. We welcome you to the National Health Insurance Authority, where our vision statement is leading the way in providing access to affordable, quality healthcare that Bahamians deserve. We are transforming the healthcare system upon which the future well-being of Bahamians depend by putting patients at the center of every decision we make. And this is our mission statement here at the National Health Insurance Authority. Who are we, you may ask? We are passionate. We are progressive. We focus on partnerships. We are people filled with integrity, and our organization is built upon respect. We're passionate about bringing universal health care to all Bahamians. We're progressive in our relentlessness in expanding access to quality health care through progressive solutions supported by technology. We are dedicated to delivering affordable health care through partnership, and we are committed to doing business with integrity, accountability, transparency, and sincerity. And we're honoring our beneficiaries by providing care and respect in all aspects of our service. And so what is our focus here at the National Health Insurance Authority? As a part of our National Health Insurance Bahamas Wellness Program, we are dedicated to creating a platform where our beneficiaries are encouraged to incorporate regular exercise into their daily routine, where they're focusing on healthy eating, understanding and recognizing that food is as medicine. And then we also want to focus on our mental, emotional, physical, spiritual, and our psychological health. And so our goal at the authority is to provide opportunities for our beneficiaries and the Bahamian public at large to adopt these practices. Here is where we are now at the National Health Insurance Authority. We are deeply committed to leading the way in providing access to affordable quality health care, which Bahamians deserve. And since our inception in 2017, we have worked hard to deliver on this vision and to advance the path to universal health care coverage. And so our current enrollment growth, we currently offer primary care coverage to over 144,000 Bahamian citizens and residents throughout the Commonwealth of the Bahamas. Our demographics is very diverse. Currently, the Bahamians that are enrolled and the residents that are enrolled in the NHI Bahamas program are spread across 17 islands, and they consist of 6,700 plus Bahamians under the age of 5, and we call them our pediatric population, and over 16,000 beneficiaries over the age of 65, whom we call our precious pearls, and they make up the geriatric population. When we last conducted our patient satisfaction survey, 96% of those beneficiaries enrolled in the program stated that they were satisfied with the service that they are receiving. Our provider network is very expansive, and currently our network consists of 141 physicians, 79 primary care physician facilities, and 9 major labs. And these facilities, and as well as the labs and our physicians, are spread across 5 islands and 16 locations as it relates to our laboratory services. Our beneficiary information is documented within an electronic health record, and we have enabled the telehealth feature. And we know that this feature has been widely adopted and practiced since the COVID-19 pandemic. This afternoon, this is January. We are still in the first month of the year, and many of us may still be working on our New Year's resolutions. Everyone wants to have that slim toned body, lose that weight, go in the gym. Many of us may have joined the gym. Many of us may have started an exercise program. Many of us may have stopped eating that fast food. Many of us may have started reading more or focusing on self-care. And so this afternoon, a part of focusing on self-care and focusing on ourselves, we wanted to educate the Bahamian populace on what is an annual wellness visit? Why is it very comprehensive? Why is it important for us to make sure that we visit our doctor, even if just once a year, to ensure that we complete these lab tests? We get we order the labs, and then we also go back and ensure that we receive the results that the labs would produce. As a part of the NHI Bahamas program, and as a beneficiary, this service, the annual wellness visit, which we term that service, it's a free service provided to all beneficiaries enrolled in the NHI Bahamas program. And so once you would have enrolled through one of our 4 options, whether it's in person, online, or via telephone and via email, you would be given the information that you needed to visit your doctor and ensure that the annual wellness visit occurs. This afternoon, we have the person of Dr. Keith Rivers. He is a consultant in the Family Medicine Department of the Princess Margaret Hospital. He earned his undergraduate medical degree at the University of the West Indies in Mona, Jamaica. He also has a doctorate of medicine from the University of the West Indies and a master's in geriatric medicine from Cardiff University School of Medicine in Cardiff, Wales. He also has a mini fellowship in geriatrics from David President School of Medicine, UCLA. Dr. Rivers is also an associate lecturer in family medicine at the University of the West Indies School of Medicine. He has published in several peer-reviewed medical journals. This afternoon, without further ado, we would like to take this time to welcome Dr. Keith Rivers. Throughout the presentation, like I first mentioned, and for those that would have just joined the call, feel free to place your question and answers in the chat feature, and we will read those questions to Dr. Rivers during the question and answer period. Without further ado, Dr. Rivers, you are welcomed.
Thank you so much, Ms. Sawyer. Thanks for that warm introduction. Good afternoon to everybody. It's a pleasure that you allowed me here to share this information with you. And so, without any further delays, it's a very short presentation, so I'm just going to share this information with you, and feel free to stop me if you wish. And if you have any questions at the end or at the beginning, I'll be more than happy to answer, okay? And so I'm going to load my slides and we will go on. So as Ms. Sawyer said, the topic for today is a comprehensive guide to my annual wellness visits. And just for a historical perspective of what's happening, I want to just let everybody know that physical examinations, although not formal like it is today, it could be dated back to about 2,500 years to Hippocrates, who was once called the father of modern medicine. So he introduced the concept that we should always look for the natural causes of illnesses. And we should seek to prevent diseases by lifestyle changes. And of course, moderation in all things. Now, this is just a picture that I pulled up off the internet, but the reason why I put this here is that because in the great halls in the Middle Ages, these great halls were either the lobbies of big churches, the lobbies of castles. Artists painted life in the hospital at the time. And here we see some of the care being given. These great halls were run by Christian Brotherhood. Some were classified as doctors, some were apothecaries, some were carers. But in this picture, if you could look, here we see a beggar. Obviously, he has been seriously injured. We look at his face. He seems to be very terrified. He's received a huge wound, which in many times would have killed persons in those days because there are no antibiotics or anything. And this attendant, as you can see, is washing his feet because he's being touched. And it is believed that in those days, touching is healing. So fast forward in today's modern medicine, even though we still concentrate on healing, prevention is just as important, or I would say arguably, it's even more important than healing. And so prevention today is achieved through the annual physical examination, and that's what these slides and presentations are going to be about today. So you could ask yourself, what is an annual physical? So an annual physical is an exam that your doctor performs to check your overall health and screen you for possible conditions such as diabetes, high blood pressure, heart disease. Your annual exam is not designed to treat a particular illness. Instead, it's intended to help you prevent, like I said before, prevent you from developing diseases and as early as possible. So the annual physical will help you to detect medical conditions that could already be developing. Trying to change my slides here. Oh, yes. So what happens when you go to a physician to get an annual physical? Well, there are several components of physical examination. Each component provides your doctor with information about your overall health. And it can help to detect common medical conditions in the early stages. And that's what's important. You want to find these things in early stages. Now, some of the key parts of what to expect at a physical examination include health history. That's where we as physicians take a full history of what's going on. We perform vital signs. There's also a physical assessment where we actually examine the persons. And of course, we do blood tests. And so I'm going to go over each of these components, 1, 2, 3, 4, separately. So during the health history, your doctor will ask general questions about your health to see if anything has changed in your health. Also, your doctor, when you do it, will be able to evaluate if there are lifestyle changes that can be recommended to help you become healthier. And the health history can also help your doctor to understand your specific health goals and the type of lifestyles you would like to live. So your doctor will ask about any previous medical conditions, if you've had any surgeries in the past, if you have allergies, what medications you're currently taking, if there's any significant family history that might actually be passed on to the patient, like maybe a strong family history of breast cancer, prostate cancer. And we also ask about social history, the type of job that you have, is it impacted on your health? Do you smoke? Do you drink alcohol? Stuff that is relevant to when you present to the doctor. And of course, vital signs, they're very important. And these vital signs, these include your height, your weight, your heart rate, your blood pressure, the temperature, your respiratory rate, or we call it the breathing rate, the oxygen levels, and even sometimes we check your blood sugar. And your vital signs, as I this can help detect possible risks for developing other diseases, such as diabetes, high blood pressure, heart disease. And so one of the more important part when you do your physical exam is the vital signs. Some medical conditions or illnesses almost always affect one or more of these vital signs. For instance, if somebody has asthma, we would expect them to have an increased respiratory rate like we saw before. If they suffer from hypertension, the blood pressure is obviously going to be elevated. And when they suffer from diabetes, of course, you're going to have elevated random blood glucose. The physical assessment is also another important part of the annual physical. And the physical assessment is that part of your annual physical where your doctor will physically examine you to ensure you're in good health or to detect any bad health, if that's the case. So during a physical assessment, your doctor is going to listen to your heart and lungs. He's going to examine your tummy or your abdomen. He's going to check your eyes, your ears, your nose, your throat, and visually inspect you for any abnormal appearances or any signs of diseases. And if you have any specific symptoms or concerns, the doctor may adjust the physical checkup to address that area of concern. And of course, as a part of the physical examination, we do male assessment, we do female assessment, and for some physicians, they even do pediatric assessment. But because that's outside of my specialty, even though I do see children at times, I'm just going to go through the adult males and the adult physical examinations. So the discussion about screening for prostate cancer should take place at the age of 45 for men who are at average risk for developing prostate cancer. Men who are at high risk for developing prostate cancer, such as those with a close family members who has the disease, should really start their screening around the age of 40. And a lot of people, especially Black males, not just Black males, they're all males, they have some aversion to wanting a digital rectal exam, but it can save lives. And what I tell people all the time is it's not just a digital rectal exam that we do to screen for prostate cancer. We also do a blood test called a PSA, but I don't want to jump the gun because that's further on in this in the presentation. For females now, there are two exams that are very, very important part of screening. That's one, the breast exam, and as you'll see on the following slide, the pelvic exam. So feeling for abnormal lumps may actually detect breast cancer or even benign breast conditions that can be treated or cured. And the doctor will also check under the armpit for lymph nodes, and they look for any type of abnormality of the breasts, any abnormality of the nipples. If there are any inverted nipples, or are there any signs of lesions like abrasions and cracks and all of that stuff, we look for all of those things. Also, like I mentioned before, the pelvic exam is also a very necessary part of the annual physical for a female. And the pelvic exam allows for the examination of the vulva, the vagina, the cervix, the uterus, the ovaries. Routine checks for sexually transmitted infections are also done during this time. So when we do our pelvic exam, we can do a pap smear to check for cervical cancer, or we even do HPV testing to see if the person has a human papillomavirus. And all of these conditions can be treated. Blood tests, again, these are very important. So during an annual physical, your doctor, when you do it, will order certain lab tests to evaluate your overall health. And these blood tests will typically measure your hemoglobin levels, or what Bahamians commonly call iron. It'll evaluate your electrolyte levels. It can check for your blood glucose to see whether you have diabetes or not. We can check your cholesterol levels. And very, very importantly, we do kidney function tests. Among these liver function tests and other stuff are done. And we call this a blood test. We usually call this a Chem 25. And the lab test may also include a urine sample, and like I mentioned before, a pap smear for women, and a PSA, like I mentioned also before, for a prostate cancer for men. And that PSA is called a prostatic specific antigen. Now, if you have a specific health concern or have a health condition in your history, your doctor may order additional testing that I haven't listed here because they're not routinely considered as part of the annual physical. So the big question is, who should get an annual physical in the first place? Anyone who is at risk for health problems or who already has an existing health concern should always have their annual physical exam done. As we age, our risk of many health conditions increases. So while there's no specific age for an annual physical, it's very necessary to have the annual physical done as we get older. So those who are older should strongly consider the benefits that an annual physical can provide. But to tell you the truth, overall, who should get it? Everyone. Believe it or not, even little children and babies. And so that first year exam when the person turns 1, that's actually a part of a pediatric annual physical. Of course, like I said, that's outside of the scope of my specialty, so we won't get into that. And, oh, sorry, slide went back. So when we do an annual physical, we should always follow up. And follow-up is necessary for certain reasons. There's no denying the fact that a doctor's visit can be one of those things in life that you would rather avoid. Nobody wants to come and sit in the doctor's office for hours. Many patients have difficulty making it to their physician's office in the first place. And when they do come, they always find it tiring to sit there, wait, spend a large amount of time waiting for the doctor. So it may be attempting to ignore your doctor's advice to come in for a follow-up appointment. But if you do come in for follow-up appointment, there are compelling reasons for you to make that decision. For one, you can get more information. So you may have gone to the doctor previously, the week before, the month before. You didn't properly hear what the doctor said, or you didn't completely comprehend everything that was said in your initial visit. So fortunately, there are follow-ups. So when you return for your follow-up, this allows more time for you to get those answers and questions that you had that you missed during the previous exams. Of course, part of the annual physicals, as I mentioned, are blood tests or lab investigations. So if you had come in for your annual physical and your doctor had ordered lab tests during your initial visit, it's possible that your diagnosis or treatment options might change when the doctor receives the test results. So your follow-up visit will likely include a discussion of those tests, and the results will be explained to the patient so that they could know what those results mean, whether those are normal results or abnormal results. The follow-up visit will allow the doctor time to consult with the patient and explain what those things mean. It also gives the opportunity to discuss medication issues. Occasionally, the medications originally prescribed to patients to treat their issues may have either some unexpected, or I would say even some undesirable side effects. So with the follow-up visit, your follow-up appointment is an ideal time to discuss the concerns about any new medications, even old medicines. If you're now developing side effects from them, you could use the follow-up visit to discuss these concerns. It's also a good time to confirm the instructions of how to take the medications properly if you haven't been taking them properly, or if you think you haven't been taking them properly. And it's very important because now, number 4, the person can, and the doctor can, discuss any additional medical issues. So on the initial doctor's visit, it's easy to become focused on one issue and forget about the other things that you wanted to discuss with your doctor. You may have left the office and say, wow, I talked to the doctor about my low back pain, but I didn't tell him that I was passing urine a lot. And so a follow-up visit allows you time to write down the other issues that you did not discuss and discuss them with your physicians, and have a bearing on your treatment options and overall medical care, and discuss them adequately with your physician so that you can know what is going on. And finally, it gives both the doctor and the patient the opportunity for proactive care. And when I say proactive care, I mean ongoing care. So keeping your follow-up appointment with your doctor indicates your willingness to take appropriate steps to handle your medical care. And so we want patients to understand that even it's a team. It's not just a doctor, it's a team. But your doctor is a very important part of the team in helping you and assisting you to deal with the medical issues that may arise. And your doctor will keep you motivated to maintain current medical care. And so a follow-up visit is very, 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 very important. There's no use to do an annual physical if there's no follow-up. I kept the presentation very short. This is the end of the presentation, by the way. I kept it very short because I was told there'll be questions and answers. But if anybody has any questions or answers, feel free. Oh, sorry, if there are any questions, feel free to just send me those. We there? Hello? Can anybody hear me? Are we still online? Hey, Miss Sawyer, I can't hear anything. Okay, but everybody can hear me? Oh, so, what? Sorry, what was the question again? Okay. All right, so there's a question about what about the SMART blood test, and if we have to pay for follow-up. So I'm going to answer the first one, and then I'm going to answer the second one. A SMAC blood test is a blood test, a general blood test that checks for blood sugar. It checks the kidney function tests. It checks liver function. It checks your electrolyte. And so there are certain SMACs that we order depending on the patient's complaint. For an annual physical, the SMAC test that we usually order is called a SMAC 25. And this gives us a wide idea of what's happening with the person. For me, the most important part of the SMAC test is the kidney function test, because I want to make sure that patients' kidneys are functioning well. Of course, that's not the only thing. I want to make sure everything is normal in the SMAC tests. But this is a test that checks the chemical component of your body, okay? And the most basic SMAC is a SMAC 7, where you basically only check for diabetes and you check the kidney function test. A SMAC 25 is a wider test that could look for uric acid to see if a person has gout, to look at the liver function test to see if there are problems with the liver. It also checks, again, like I said before, your kidney, your electrolytes, and your blood sugar. Now, is there a follow-up? Is there a price for follow-up? No. Under National Health Insurance, no visit under an NHI patient is free. Unless a person presents for something that is not covered under NHI, you do not have to pay anything. And so follow-up visits for an annual physical is free of charge, or should I say, instead of saying free of charge, I said it's covered under NHI. So patients don't have to concern themselves about bringing any money to the exam.
Hi, Dr. Rivers.
Hello.
Yes, so I am back now. I think we had switched to Facebook Live, and it disconnected my ability to turn on my mic. But thank you so much. Thank you very much for ably explaining the SMAC test, as well as the question on the follow-up, and as it relates to payment.
You're welcome.
So a lot of persons in the chat are stating that the presentation was very good, great presentation. I thought that the presentation was very thorough. I learned a lot more than I thought I knew. And so I just had a question, and I think this question has to do probably with a personal preference as physicians. You mentioned the need for the follow-up, and I think the follow-up, I would definitely like to stress that the need for the follow-up and the actual following through with that follow-up, because we tend to go and we have the annual wellness visit, we go do the blood work, and then we schedule that follow-up, but when it's time for the follow-up, we don't follow through with the follow-up. But what my question to you simply has to do with that follow-up. When do you think would be the best time for the patient to complete the blood test? Would you prefer them to complete the blood test before they come for the actual wellness visit, or you prefer to see them, evaluate them, and then send them for the blood work? The reason why I'm asking is because I'm realizing now that there are a few physicians that are now shifting to ordering that lab work before, then they see you, so that when they come and see you, that they already have the lab results.
Okay, well, I guess I'll tell you what my personal preference is. I think most medical diagnosis should be done first by, like I mentioned before, a medical history, and secondly, by physical examination. And so I want to first listen to that patient. I want to put my hands on that patient, touch that patient, and according to what they tell me and what I find on examination, I'm going to make my diagnosis. Based on that information that I've gotten during the clinical exam, Then I send for any other type of investigation, whether it's blood tests, x-rays, ultrasound scan, to either confirm what I'm thinking about or notify me of something that I never thought about because I'm totally lost because of what they came in. If some doctor order the labs first and then they see the patient, I guess that's a personal preference. And it could be due to their time availability. I'm one of those persons who like to spend a lot of time with my patients. And so I prefer to see that patient first, and then I order any type of subsequent investigations.
Okay, thank you so much, Dr. Rivers. I like the aspect of being that hands-on doctor, being able to question, being able to touch, being able to feel, and then from there you can continue on with the assessments.
Okay.
And so okay, so there's a question that came through in the chat, and I'm just combing through it before I ask it. So the question speaks to, given most persons tend to remain with physicians with whom they are most comfortable, regardless of their level of specialty, for an annual wellness exam, how important or critical is it that the clinician's level of expertise for an annual exam that is not focused on a specialist health issue?
But that's the whole thing. I want to reiterate that these annual exams are done mostly by family physicians, whether you want to call them generalist, family physician, family medicine specialists. You have to first detect an illness in order to know to treat it. If a person comes and they have absolutely no issue at all, I cannot just send them to a cardiologist or a urologist or an endocrinologist or any kind of ist. So that is the whole purpose of doing the annual physical, to, like I mentioned before, to detect these illnesses. When you've come to your primary care provider, which I consider myself the point of first care, you first to me, and there are a whole lot of things that a primary care physician can treat that you don't even need to go to a specialist in the first place. Now, if you come in with a specific complaint, you see a breast lump, or you are having issues like you can't concentrate, you have heat intolerance, diarrhea, stuff like that. This could sound to me like you're having some issues with your thyroid. So based on that, I would know not to send you to a cardiologist or urologist, but send you to an endocrinologist. And so, but most primary care physicians are very comfortable to treat a whole lot of conditions without specialty care. Of course, we are not trained to treat somebody with a specific concern, like a breast lump. And even though to some degree, we might be able to treat somebody who comes in with urinary retention difficulty, a male coming in with a urinary retention, they're finding it difficult to pass urine. Yes, I can put them on medications, I can put in a Foley's catheter, but that person has a right to see a specialist for that, a urologist. So based on that initial visit and the patient's complaints and my exam findings and the lab findings and the radiological findings, I will have the best information to know who's the best specialist for me to refer that patient to, or who's the most appropriate specialist for me to refer that patient to. Sometimes you need to send them to more than one specialist.
Yes. And so then again, that lies in that follow-up, right?
Yes.
Yes. At what age? Okay, so I'll go back. Let me go back to that question. Another question came through. The question is the opposite. So a specialist should not conduct the annual wellness exam, but direct you to a primary care physician, or can or should a specialist conduct the exam?
A specialist at first is a doctor. So to say that the specialist cannot conduct an annual physical, I think I'll get shot. I will be shot to say no, they can't. But yeah, so at first they're a physician, and then they specialize in that one particular field that they're interested in. Most specialists, because they are so busy dealing with that one particular part of the body, that one particular part, they don't have time to do an annual physical. I'm not saying that all of them, most do not. And so that's why I look at the beauty of a primary care physician, because they don't just look at one system like the heart or the liver or the lung or the muscles or the spine. They look holistically at the whole body, the whole person. That takes a lot of time. That takes a lot of dedication. That takes a lot of motivation. So some people find primary care very boring. And so they prefer to just do neurology or urology or whatever it is. But all physicians, as long as they have a medical license, they are well qualified and well equipped to perform an annual physical. But in the interest of time, because they're so busy with their specialty, most probably do not have the time or probably the interest. I send a lot of people to specialists, and when they've treated that problem, they just send the patient right back to me, because they really don't care about their primary care. So they just send them right back to me. And that's how it is in medicine. It's that referral back and forward to specialists and back to the primary care physician. We look at the patient holistically, and we manage all of the medicines that they're on that might be from different specialty. As a person doesn't even have to just be at one specialty. They could be seeing a cardiologist, a urologist, whatever. And I look at all of these medicines, and sometimes I call the person, does the person need to be on this? I'm going to take them off because they have a side effect. And so I'm sort of like the police that guides their care.
Yeah, so it's all about having a relationship. You know, I think in healthcare, it's a term that we use, allied healthcare. So it's about creating alliances and relationships with different branches. There are different branches of medicine, and so at the end of the day, those branches all connect to the root, right? And so we definitely have to come back to the source to identify the problem. There's a question I know we mentioned as it relates to physical examination, specifically to females. At what age should females start getting mammograms?
Well, according to the American College of Gynecology, they really should start at 40. And the reason, but some people can start before 40. But usually if persons have, especially the younger people, the younger persons, the younger patients, they do have breast issues sometimes. But we usually don't do a mammogram. And for the very reason that their breast tissue is very, very dense. And sometimes you don't even know what to make of a mammogram of somebody who is young and a very dense breast tissue. So we do an evaluation called an ultrasound scan of the breast. As the female gets older, the breast becomes less dense, and so a mammogram would probably be the most appropriate and the best evaluation. So we usually start at age 40. Now, for people who have who has high risk factor for the development of breast cancer, like an immediate relative, a very strong family history of breast cancer, we sometimes start mammogram earlier than 40. But that all depends on history. Persons with a strong family history of the BRCA gene, a first degree relative with breast cancer, we usually sometimes start mammogram. But the age for most people is 40.
40, okay. And what would you describe as a first degree relative?
A first degree relative is a brother, sister, mother. Oh, sorry, it can't be a brother. A sister or mother.
Well, it can be a brother. I think I saw something right during Breast Cancer Awareness Month. There was a story that was on the U.S. press, and they were talking about the high incidences now of male-related breast cancer.
Yes.
So can that, if you had a brother or a father?
Yeah, a brother is a first degree relative, but I was just saying it in relation to breast cancer.
Okay.
Yes, men have had breast cancer, but that's very, very rare. And that's a really different topic, but that's very rare. Thank goodness. Fortunately, that's very rare. But I have even seen males with breast cancer in my career, my short 20 plus years of physician.
Dr. Rivers, you are such a mouthful of information. I know that you currently practice at Able Hands.
Yeah.
Right. That's your family practice.
Yeah.
And just
primary care center.
Yes, and I just wanted to mention that Dr. Rivers is an NHI physician. And so for those of you that are beneficiaries, and if for those of you that is hearing about NHI Bahamas for the first time, and you're interested in signing up or enrolling in our program, Dr. Rivers, as you can see this afternoon, he's a wealth of knowledge. And so we ask that you come in, take a look at our listing. Our listing is also provided on our website, and you can find more information as to the provider care that you can receive from primary coverage under the National Health Insurance Program. I just wanted to check a question that's in the chat. So the question speaks to Dr. Rivers. Is Dr. Rivers a family doctor or a specialist? And I think this person came on late, and so according to Dr. Rivers' biography, he's a family medicine consultant through the family medicine department at Princess Margaret Hospital, right, Dr. Rivers? Yes.
Yes. So I just want to clarify. A family physician actually is a specialist.
Okay.
What happened is we list primary care physicians as either a generalist or a family physician. A generalist is a very well-trained individual who has adequately completed the requirements of medical school, the requirements to practice safely under the Bahamas Medical Council, but they have not done a postgraduate degree. A family physician, on the other hand, is also a generalist, believe it or not, but they've gone on to do an additional 4-year training at whatever medical university. Some people go to the UK, some people go to the US. There is a very, very good program here in the Bahamas that is guided under the University of the West Indies, Mona, Jamaica, where you can enter that program for 4 years and get a University of the West Indies degree. But in addition to my 4-year family medicine specialist exam, I am a specialist as a geriatrician. I went on to Cardiff University in Cardiff, Wales, Cardiff School of Medicine to do a geriatric specialty degree. And I was also awarded a David Dresden a scholarship to do a mini fellowship in geriatrics at Veteran Hospital through the UCLA in the US, at UCLA School of Medicine. So yes, I am a family physician. Yes, I am a specialist. And also I'm a specialist as a geriatrician.
So you are just a wealth of knowledge. Yes.
I'm a person who likes school.
A person like school.
A
professional student.
Yes.
So we have one more question, Dr. Rivers, and it has to do with allergies. What is your professional opinion on the increase in allergies? For example, nut allergies appear to be on the rise versus when I was growing up. I can also name a few others that appear to be more prevalent than in the past. Are there any speculations? And I was just wondering, what would your professional opinion be in this regard to nut allergies? Well, in this regard to allergies, specifically nut allergies.
Well, there seems to be a rise in allergic conditions, I'm going to say, and to the mere fact of modernization. 30 years ago, we didn't have as much cars as we have right now. And so there was less air pollution, there was less carbon dioxide and carbon monoxide going into the air. And we inhale these products. If you look back in history, like places like London during the years of industrialization with all of the smoke and the fog and everything, people have had respiratory issues. Now, I'm going to tell you that there's something called atopy that can be considered allergies or allergic-like reaction. And those atopies are people who suffer from either asthma and eczema and both. And it's not very, very clear whether the rise in this are due to environmental changes because of modernization. Nut allergies is unfortunately, even though I could say, I wouldn't say it's rare, but I would say it's not uncommon. It's not uncommon, but I can't say it's rare. But fortunately, it's not common. I don't know if there's a link between the destruction of the environment and nut allergies. But of course, for anybody who is interested in biotechnologies and everything, you know, there's a whole lot of farming where we have to produce foods really, really quickly to put them to market because the world's population is increasing. So the way our great-grandparents farmed without the fertilizers and everything, we wouldn't be able to feed 7 billion people. And so biotechnology is one of those specialties in farming that allows us to produce fruits and vegetables and even nuts faster. I'm sure when you go, sometimes you go to Super Value and you would see there are always mangoes. How are you getting those mangoes and it's just not mango seasons? So those are due to, and thankfully, to a scientific manipulation to cause fruit to bear out of seasons. I'm not saying that a rise in nut allergy is due to those things, but it's an interesting thing to look up, research, and maybe somebody could educate me about it.
Yeah, that's definitely true. You know, there's so many things that that we were not, I guess, exposed to growing up.
Yes.
Well,
yeah.
A lot of persons may look at me and say I'm very young, right? But times have also changed since I've been a child. But yeah, that is definitely something that we can definitely research and find out, see if there's any linkages to the environmental exposures as a result of allergens. I know persons have stated before, and just to kind of shift back to the topic about breast cancer, persons are for lack of a better words, they're linking a lot of our cases in the Bahamas to environmental issues as well. I don't think any studies have been completed as yet, but I'm sure this is something that we can also look into, finding out more information. So I see Ms. Pintard has a question in the chat, and we will address this question, Ms. Pintard. I don't have the exact answer for you, but I will direct you as to where you can locate your answer. Dr. Rivers, thank you so much for taking time out of your schedule to sit down with us, to educate us, to provide awareness, as well as to answer our questions. This time that you spent with us was very valuable, and we thank you for this, and we wish you all the best in your practice. We wish you all the best as you continue to provide care to our Bahamian populace. Dr. Rivers, I just would like for you to discontinue sharing your screen for me so that I could provide some information for those that are on the call. I definitely would want to address Ms. Pintard's question. All right. Good afternoon again. And so at the National Health Insurance Authority, we are excited about all of the wellness opportunities that will be afforded to our beneficiaries and the Bahamian public. And so this evening we continue with our Power Hour, which is offered every third Thursday. We provide a free fitness session to our community. And this session is often headed or instructed by a certified fitness instructor. Our beneficiary educational session is hosted on a monthly basis. And in light of the COVID-19 pandemic, we have provided an opportunity to educate the Bahamian population in a hybrid style. So we either host sessions virtually, and we also provide an opportunity to host the sessions in a face-to-face environment. What's coming up this year? Every quarter, we will be hosting a virtual wellness challenge, and these challenges are intended to focus on nutrition, physical activity, stress management, and lifestyle behavioral change practices. And these changes and these focuses are intended to help improve our overall health and wellness as Bahamians. And so we encourage you to ensure that your email address is updated in our database and in our records. If you are an NHI beneficiary, for those of you that are going to sign up today and moving forward, make sure that you provide us with an email address so that you can receive information on our wellness programs. Again, we want to encourage you to join us this evening at 6 p.m. at the C.W. Sawyer Primary School for Ultimate Fitness with Natasha. So do not forget to bring your exercise mat or towel, and do not forget to bring a family member or friend. This is actually a family workout, and so we're encouraging families to join us for free as we all get fit together. And so, Ms. Pintard, here is the answer to your question. If you contact us via email, via telephone, or even connect with us on either one of our social media platforms, Facebook, Instagram, LinkedIn, as well as Twitter, we will be able to provide you with information as it relates to Dr. Rivers being a provider within the NHI Bahamas program, and if he has availability to accept new patients. And so thank you, everyone, this afternoon for taking time out during your lunch break. I hope that we all sat at our desks, ate lunch. For those of us that are on the road doing errands, I'm hoping that you traversed the streets very cautiously. But we thank you for taking this time. Please feel free to follow us and to like our social media platforms, and you'll be able to receive this video recording and share it with family members and friends. Have a great afternoon, everyone.